Hello everyone, welcome to our channel. In our channel, we have many lectures for the medical students. This medical knowledge playlist is for the other students and for the others to know about the medical knowledge of the human organs. So, in this video, we will know about the medical knowledge of the human liver. So, in the image, it is marked as liver and gallbladder. If you know the details of the knowledge of the liver and gallbladder, you can understand how jaundice is caused. Situation of the liver, where it is in the human body. So, in the human body, liver is in the upper part of the abdominal cavity beneath the diaphragm. So, the trunk, the middle part of the body is divided into thorax and abdomen by the diaphragm. So, just below the diaphragm, this liver is situated in the upper right hand portion of the abdominal cavity, on top of the stomach, right kidney, and intestines. Do you see the shape of the liver? It is like a triangle shape, so that apex is towards the left and base is towards the right. Color is dark reddish brown. If you see the weight of the adult liver, it will be weighing 1 to 1.5 kg in the males and 1 to 1.2 kg in the females. There are two distinct sources that supply blood to the liver. Do you know how much blood circulates in the liver at any time? 13% of the body's blood supply circulates in the liver at any given time. In the liver, there are two types of blood flowing: oxygenated blood flowing through the hepatic artery, and nutrient rich blood flows through the portal vein. Otherwise, are you seeing the small intestine in the image? So, whatever we eat pass through the stomach and enter the small intestine. So, whatever we eat, the small intestine, the nutrients are absorbed through the blood and passing through the portal vein reaches the liver, so that the nutrients are stored in the liver. So that's how the portal vein carries the nutrients from the intestines to the liver. That is the one important function of the liver. So this is the human liver. Right, it consists of two main lobes, right lobe and left lobe. You can see this left side is the right lobe and right side is the left lobe. Both are made up of about 8 segments according to the blood supply. So this is again given clearly, right lobe and left lobe of the human liver. This is how when you see the liver from the front. This is the when you see the liver from the behind. In this picture you try to see the lowermost one green color organ, that is the gallbladder, situated in close relation to the liver. That's how the bile secreted from the liver is carried by the gallbladder and stored in the gallbladder. Functions of the liver. Liver has about 500 vital functions. So we will tell only the important functions. Production of bile from the liver, which helps in the fat metabolism in the small intestine during digestion. It helps in the breakdown of fats in the small intestine during digestion. Production of cholesterol and special proteins. And whatever you eat from the small intestines, the glucose, that is carbohydrate, protein, fat, everything is carried from the small intestines by the portal vein to the liver, where they are stored. So many metabolism: carbohydrate metabolism, protein metabolism, fat metabolism take place in the liver, and they are stored whenever they are needed, they will be released from the liver. So it is the simple way to tell the function of the liver. So two different functions of the liver: one is storage of the nutrition, two is secretion of the bile through the gallbladder. So this bile will reach again the small intestine. So that's how this bile juice will help in the breakdown of fats in the small intestine during digestion. So how this jaundice is caused? Now from this details of the functions of the liver, you can understand when the liver is affected by any infection like hepatitis, which is caused by the viruses hepatitis A, B, C, like that, or when the bile juice is carried from the gallbladder to the intestine, when it is blocked by some causes, then this secretion of bile into the small intestine is affected, so that this bile pigments are carried in the blood, causing the excess of the bile pigments in the blood, causing the symptom of jaundice. So jaundice is not a disease. Jaundice is a symptom of many diseases. So when jaundice is present, when you go to the doctor will check up and find out the causes for the jaundice, where it is the problem in the liver or in the gallbladder or in the pathway. Sometimes even before the liver also, excess of blood destroys. For example, in the malaria, like in that case also jaundice will be present. So this video helps you to understand the situation, details of the liver, function of the liver, and one important point is how jaundice is caused. So like this, you try to watch our medical knowledge playlist in our channel. We will describe about the other organs in the human body, so that you will have little knowledge of all the organs. So those who have not subscribed to the channel, subscribe now, so that you will receive the everyday notification.